Hi everyone, happy Monday morning. I hope you guys are having a good start to the week. I know it's been a little while since I have come to you live with a video, probably over a month, but there are some messages out there that I thought I could maybe provide some clarification on. So here I am. No doubt that you have all heard that COVID case numbers are rising across the country and here in Kern County as well. And some are concerned about this, and others are more concerned about the ramifications of this, like moving back to the purple tier, having businesses closing, having schools moving further away from opening for all children, and everything in between. And I wanted to shed some light on it because I have come across a lot of different opinions and articles that I feel just make this so much more confusing than it really is. And what is most troubling to me in the rise of numbers that we're seeing is that the rise in hospitalizations and deaths is also ensuing. Right now across the nation, we have 65,000 people in the hospital, and we are seeing around 1,100 to 1,300 deaths per day. Now, this is nowhere near the 2,200 deaths per day we were seeing in New York City in April, but here's what concerns me now. Some of the states that are being hit the absolute worst right now, such as the Dakotas, Montana, Iowa, Wisconsin, Texas, are fairly spread out, or even rural areas in certain places, and people can be spread out. And when this was first happening, particularly in New York City, I think a lot of suburban America felt reassured that they didn't live in such a city that was so crowded with subways and high rises and apartment buildings and people literally like on top of each other when they are walking through the streets. But what we are seeing in these other states should teach us that the virus is able to spread not when people are on top of each other, but when people are indoors with each other. And you've seen our local numbers. We hit 300 again today. A month ago, we were literally teetering around 40, 50, 60 a day, and now it's exponentially starting to rise again. And not surprisingly, our temps have cooled down. And while we're not super cold by California or Bakersfield standards, we are heading indoors a little bit more. And as we get further and further into this holiday season and into the colder weather, we are only going to retreat indoors more. And this is going to be a problem for us. And we are in a position to be able to stop it now. I keep seeing these articles where it talks about how the mortality rate of COVID is so much better due to improvements in treatment, and we don't need to worry about the rise in the numbers anymore. And I will tell you that the first part of that statement is true. Our mortality rate is dramatically better than it was when this first started. And it's because healthcare workers across the country have learned so much about how to handle this virus, when and when not to intubate a patient, the use of steroids, the use of anticoagulants to help prevent blood clots, remdesivir, and all sorts of other agents that are in clinical study. But we have to remember this. Our mortality rate is only as good as our access to a well-functioning and non-overwhelmed healthcare system. So if we start pushing the limits, seeing our ERs and our hospital and ICU beds fill up, all of these wonderful treatments become completely irrelevant if we can't access them. And this is why our actions are so important right now, so that we don't end up like what is happening to so much of the Midwest, where they are completely inundated in many of their hospital systems. And please don't be fooled to think that this can't happen here in Kern County or in the county that you're watching from. As recently as August, we were struggling to staff our hospital beds. And while we had a bed available for you, we didn't have the nurse to take care of you. And if you have ever been hospitalized or had a loved one who has been hospitalized, you know very well that your care cannot be implemented without a nurse at your bedside. So let's talk a little bit more about this mortality rate. You have heard numbers literally across the board, I think, when it comes to mortality rate, more than you have ever wanted to hear. And probably as high as 40 and 50% if you were intubated and in the ICU in April, to as low as 0.6% recently. And there's so many numbers that it makes your mind spin, and you kind of don't know what to believe anymore. And you can pretty much find an article supporting any one of those numbers. So here's what I can tell you in very basic terms. When this thing first started, mortality was crazy high. That's why we panicked, and particularly if you were hospitalized and in the ICU. But as social distancing guidelines and masking guidelines came into place, then hospital numbers came down. The hospitals became less full. Healthcare workers had time to analyze their work and better implement treatment plans. And not surprisingly, fewer people started dying. But when you hear someone say, oh yeah, the mortality rate's 0.6% now, I'm willing to take my chances. Here's a couple of things that we need to ask them or ask ourselves if we're starting to believe that. Number one, if you're local here, why is it that our mortality rate in Kern County is double that precious 0.6%? Now, if you've watched some of my other videos, you know that I believe that you cannot accurately assess a mortality rate in the midst of a pandemic. You will only know the true mortality rate when this pandemic is over. But we need to have numbers, we need to have data, we need to see what's happening. And so people still tend to calculate the mortality rate. The reason why I feel like it's somewhat inaccurate is because when you calculate the mortality rate and you are looking at the number of deaths divided by the total number of people who have been affected by the virus. Well, on any given day, you know the number of people who have been affected by the virus because we're just looking at positive and negative tests. But out of that number, the denominator, you don't know how many of them are going to die from it. You know who's already died, but there is a handful who have tested positive in the last 1, 2, 4, 6 weeks that may still die from it, but haven't yet. So it's not a truly accurate assessment, in my opinion. But since everybody's doing it, we're going to play along. We've had 432 deaths in Kern County out of 36,919 cases. That's 1.17%, almost double that 0.6% that everyone seems to be quoting. And again, remember that 0.6% is six-fold higher than our worst flu seasons. So it is not an arbitrary number, but I do understand why some people think 0.6%, why are we doing all this? Why am I, trying to change my life because of it? But perhaps our numbers here in Kern County are higher because we have higher rates of obesity, diabetes, hypertension, heart disease. Maybe we have a higher population in nursing homes or Latino or African American individuals, all groups that have been disproportionately affected by this virus. And if you yourself don't fall into one of those categories, that's wonderful that you are not in a high-risk category, but please don't tell me that you don't know someone, or more importantly, that you don't care about someone who falls into one of those categories. And it's so important to realize our bubbles are so much larger than we think it is. And while you, if infected, may be one of the 40% who get no symptoms at all, there are 248,000 Americans who are not that lucky and who have actually died. And we're losing more Americans at a rate of 1,100 to 1,300 a day. So when we talk about how we love this country so much, what I don't understand is why we are not all trying to take care of our fellow countrymen, because we have to start doing that if we want to change the trajectory of what's going to happen. Secondly, and how you think about this mortality rate, whether it's 0.6% or 1.17%, it's all going to change based on a healthcare system that gets overwhelmed, and it's not going to change for the better. And across our country right now, talking to healthcare professionals, and supposedly us being the richest country in the world, or once was, I suppose, hospitals are above capacity. Offices within the hospitals are now being converted into hospital rooms. Refrigerator trucks are again being ordered to hold corpses because they can't keep up with it in the morgue of the hospital. Multiple patients are being put into one room, crowded in there. And we are literally, in certain places in the nation, asking asymptomatic but contagious COVID-19 positive nurses to continue to work because they are so short-staffed in the hospital. This is crazy, folks. We have to move away from this. And so why am I telling you all of this? Because I actually think we can do something about it. I know we can do something about it because we did it a month ago and we had numbers that were dramatically lower than what we are right now. So I know that we can do this as a community. And if it's happening in these other states, I don't see why it can't happen in our state either. And I promise you, I am not asking you or the world to lock down. I don't want to see our businesses suffer another round of a shutdown. And I certainly don't want to see our kids taken out of school or miss their opportunity to go to school. But I'm asking you to use a little bit of common sense and a little bit of self-control right now. You know, think of it this way. If these annoying little mosquitoes that have made their presence the last 2 summers in Bakersfield were causing 432 deaths in the last 235 days, so about 1.8 deaths per day, wouldn't you wear a little bug spray? Wouldn't you maybe cover your arms or your legs a little bit when you're going for a walk just to maybe not get that mosquito bite that is killing 1.8 people in Kern County per day? I think you would. So again, it just comes down to common sense. It is not a political issue. It's not digging your heels into the ground. It's just about taking care of one another. And so here is what I'm asking yet again. Wear your masks. I know you guys are tired of hearing about this. I am too, but I have to say it again. And don't wear them just inside the businesses, inside of the drugstore, the grocery store, or Target. If someone who's not a part of your household or your quarantine comes into your house, wear your mask. They will follow. And if you don't make it weird, it's not weird. We've been dealing with masks now for 5 months, 6 months. The science is literally irrefutable at this point in time that masks work not only to protect others, but now it's showing to protect you as well. And this explains beautifully why our asymptomatic rate went from 25% to now 40%. Because by wearing a mask, you reduce the amount of virus coming into your system, which in turn makes you less sick. So it's a win-win situation, if you ask me. Again, keep social distancing, keep washing your hands. And as the holidays roll around, really ask yourself if travel and gathering with extended family and friends for a large meal indoors is the right idea right now. I mean, is it really worth it? Some of you may answer, heck yes, it is. But for me, and I think a lot of you that are probably watching, it's not. Because I simply could not live with the idea of someone dying from COVID because I had to eat turkey with 20 of my best friends. I am just not that important. My needs are not that important, and I can wait until next year to do those things. And so I would be lying to you if I told you that I'm not worried about what's to come. But please realize I am not asking you to live in fear or to hide in fear for that matter. I want you to go outdoors. I want you to appreciate the sunshine that we have. I want you to do things that you enjoy. I want you to support our local businesses in a way that is safe for them as well as for you. You know, I just basically want you to live your life, but I want you to do it responsibly. To me, wearing a mask and getting takeout instead of not wearing a mask and sitting inside of a crowded venue is only living in fear if you perceive it to be. Not for one day since this all started in March do I feel like I've lived my life in fear. But I have lived my life in a way as to protect others. And I'm proud of that. And I think many of you who have done so should be proud as well and should continue to keep doing what you're doing, even though that COVID fatigue is so real. So that is about it. I know this was kind of a harsher message than usual, but I do hope that it helps some of you that were confused by all of this information and clickbait types of articles and headliners that are out there. And as always, just keep your head up, keep helping others, and no matter what your beliefs are, please, please be kind to one another. All right, guys, that's it. Take care.